My name's David Williams. I'm Group Director of Strategy Partnerships in Leicestershire, working for Leicestershire Partnership Trust. And today is our first of our series of podcasts that we hope will bring you more information about the Neighbourhood programme and the work we're doing. We're absolutely delighted to say that West Leicestershire is working as part of NHS England's National Neighbourhood Implementation Programme, and we're all coming together across the system to do some work about how can we make neighbourhood care work better. And the principles and the thoughts behind all of that are about how can we make sure that people live well in their community, that we get support to people across their community whenever they need it. And hopefully in doing so, people would need less attendances at hospitals for urgent and emergency acute needs, and people are better able to live together. So that's about our neighbourhood programme. Over these coming podcasts, we'll be sharing more information with you, different views and different perspectives about what we're doing and how we're working. But today I'm joined by Leslie Borrell, a GP working in West Leicestershire, who's going to help us understand more about what it means for primary care. So welcome, Leslie. Do say hello to everybody, and also please introduce yourself a little bit more than I have done.
David, thanks, and thanks for the opportunity, obviously, to speak to the audience today. So I'm Leslie Borrell. I've been a GP in this area for 25 years. I also trained here, so I've been a medic in this area for over 3 decades. I'm a partner of Bridge Street Medical Practice, clinical director of one of our PCNs, which I think is quite important for this type of work, but I'm also the medical director of our federation, and I've got a particular interest in health inequalities, but more recently there actually has been around respiratory health inequalities.
Brilliant. So the National Neighbourhood Implementation Programme in West Leicestershire, I think, is going to focus on respiratory and understanding that. So I guess for people who aren't experts in respiratory, just talk to us about what poor respiratory health means for somebody who's living in our community.
Well, I think there's a temptation for me as a doctor to leap in there with sort of numbers and figures about peak flows and spirometry and sort of things like that. But I think I want to take a step back, because one of the parts of the neighbourhood programmes wanting us to talk about is actually what this means for a person or a family or even a community. Having poor respiratory health, particularly around COPD, which is where we're going to target this, is something that impacts on people's daily lives. You know, it's that chronic shortness of breath, their inability to do their own washing, to change a bed, to climb the stairs, to play with their children or their grandchildren, to work, to volunteer. All of those things are made more difficult by a chronic shortness of breath. Now, we need to point out that not everybody with COPD has excessive shortness of breath. There are people who have less and those who have more. Also, then there's the additional impact that that will have on the needs to interact with the medical profession. But also we know people who have respiratory conditions are more likely to have other coexisting health issues like heart disease, diabetes, and of course mental health concerns. Being chronically short of breath increases your risk of both anxiety, depression, social isolation, and even suicidal thoughts. So we know that as a group of people who happen to have respiratory conditions, it has a big impact. It can lead to social isolation, which we know is a significant impact on people's health. People who are socially isolated has been shown to be as worse for your health as smoking itself. And it can also have a significant winter impact. We know that during the winters, cold homes, damp housing, and infections have a significant impact. So it has a big impact on the community in the wider sense, not just our health community.
Lovely, thank you. And it's understanding that impact on the wider community, I guess we could probably explore a little bit more. To start neighbourhood working, you've talked through the sort of the health impacts, but what else could people tackle in a neighbourhood that would improve people's respiratory health?
Well, I think that's why this is quite a fascinating place to start this journey of ours with regards to neighbourhood health, because there isn't anyone who can't contribute here in the community, even if that's trying to encourage someone to have their flu vaccination, for example, a very cost-effective method we know that can help, a very medical one, but we'll start with that. So encouraging them or thinking of ways how we might be able to allow people to access that vaccination easier, putting it in different sites, for example, in a non-medical site. We know that social isolation is a big impact. So how are we making sure, even on a personal level, that maybe our neighbour isn't socially isolated? What are we doing around that? But as organisations, how could we reach out? Instead of waiting for the person to reach in, what could we do to reach out, to actually contact people? We're living, David, at such a data-rich time. Yet, unfortunately, some of our data is still very siloed. And I'm hoping that over the neighbourhood time, we'll see a better sharing or understanding of some of this data so that we could get organisations like the charitable sector or employers or a range of people actually looking to support us. I think an area which has been very big in the news recently, of course, will be around housing quality. Damp and mould have significant impacts. And we know a lot's being done by our MPs and our governments, and we should thank them for that, to impact on those people living in sort of housing with poor standards. Has a big impact. We saw during the pandemic the rise in volunteering was not only good for you as an individual, the benefits to yourself, but also the benefits to our wider community. And we want to try and see if we can bring some of that back for this sort of cohort of groups. Because exercise, flu vaccination, and social isolation are things that can be influenced by much wider groups than just health. And I think that's where I'm hoping that neighbourhood is going to be used a lot more, understanding that a big chunk of what makes good care for a person comes from the neighbourhood, not just from the healthcare sector.
Oh, that makes a lot of sense to me, and I can see the roles there for local authorities to be able to support around housing and building that in, voluntary and community groups and others, warm spaces, safe spaces, even just presumably things that I see quite often in and around me, walking groups and exercise groups that are helping people develop. There seems as though this isn't just a solution for the NHS. This is something that everybody can do and work through.
Very much so.
Brilliant. That all makes sense to me. And I suppose thinking about that, so we've got to tackle poor respiratory health. But what does this actually mean is going to happen? I can understand the importance of it, but what's going to happen now in the neighbourhoods in West Leicestershire?
So what we're going to do, what we've agreed to do as the sort of medical leaders in the area, is get together in a multidisciplinary team to start reviewing some of our patients within that group. Now, there will be an evolving process as we learn a lot more and we start to share things. When a medic comes to the table, we're very likely to have a very medical lens. As other people come to that table, they're going to have a different lens. So first thing to say is we don't really know exactly what we don't know. And there may be some amazing learning just by having those different people around that table. But we're going to have people like the voluntary sector, the pharmacists, the housing officers, trying to understand a lot more around what this actually looks like. So we've got the data. We've selected a cohort of patients across West Leicestershire, which will now break down into the 3 different federations. Those federations will then break those down into some multidisciplinary team meetings. And we will start to understand what can be done for these patients, not just the optimization of their medications or not just making sure that they've had an invite for a flu vaccine, but trying to understand why they weren't able to access that. Trying to understand what other services could be being used more frequently for them. And we've got the 3 federations, Hinkley and Bosworth, North West Leicestershire, and my own Charnwood. I'm trying to understand a little bit more about what good care looks like so that we can feed back to everybody actually. What does good care, but not what does good medical care look like? What does good care look like? Take the word medical out of this. This is about what good care looks like. You know, patients will need to be involved in understanding what means good care for them. But I think we're going to see some better coordination, a bit of better understanding of the challenges, but also looking at those challenges through a different lens. As I say, not just, well, I offered them an appointment, they didn't turn up, but what were the challenges there? And actually, as a community, how could we address those? Not how could I, as a GP, address those? Maybe it's not my job to address those. Maybe it's someone else's. But I think by learning that, and there is going to be a lot of learning here, and a few people are going to need to maybe think differently or learn differently. I think that's going to be an amazing outcome, David. I'm really looking forward to that aspect.
It sounds incredibly exciting. Sounds really good. And from my perspective, I sit here, and I suppose one of the reasons why I came into the NHS was the real challenge about wanting to make a difference, but wanting to make a difference to people's lives and actually wrapping everything around. So, I'm very aware now that the NHS is just a small part in people's lives, and it's how do we work with everybody else to make a difference and to work things through. So, I hope it's going to be really, really exciting. I guess there's just one slight worry I've got is that working in the NHS, I understand how hard GPs are working, how much of a challenge things are for GPs. This sort of sounds like it might be even more work for primary care. I guess, is that wrong? Is that right? And what difference do you think it would make?
I mean, David, first of all, I think it's really important that we do acknowledge that GPs are working really, really hard. I do have a day job and I do see patients. I am a working GP. I think what we're looking at with the neighbourhood approach actually is looking to tweak how we're working. So these are patients we would be doing our medical part for anyway. At the moment, we're probably doing those in isolation, and someone else is probably doing their bit in isolation, and there's a whole lot of bits that maybe are not even happening at all. What we're hoping to do here is learn how we get those parts into the same room, into the same conversation. So actually, I'm probably not doing a lot more work. I'm probably doing the work that I was already doing just a little bit more efficiently. Maybe there's a little bit for me to do there. Maybe there's changing my day a tiny bit, and some people will be more comfortable with that than others. But I think when we start to do them all together and we get better learning, I think we'll find it's easier to do the job that I've got, the same job. But also, I'll start to explore my unknown areas there that could have made that work easier anyway. And keeping this focus more on the patient and less necessarily on the medicine, because we know from the data that probably about 80% of the influences of health are outside of my pen and my prescription pad. We've become very good locally with social prescribing, and we should be very rightly proud of the progress we've made there, and our INTs, to be fair, have also done really well. This isn't new work per se. This is work we've been doing and moving in this general direction for quite a while. But what I'm really hoping now is we're going to solidify into something more concrete, more solid for everybody. And yes, that's going to make some changes for us as GPs, but we're used to that. Some of us will find it easier than others, but I don't think it's going to be a massive amount of work, David. I'm confident that the amount of work put in will definitely be met with the rewards. It'd be worth doing.
And I think you've made me really think about, if we break down that isolation that you talked about just earlier about where things were and how things work, actually, and people get help early and people get it straight away and first time and all of those sorts of things, potentially over time, that's got the ability to reduce the amount of time people will come to your GP surgery seeking help. So that does make that makes a lot of sense to me. So this all sounds great. What would other people who work in other organisations in West Leicestershire, what could they do to help? Is there things that you would like other people to think about?
So I was thinking about that, David. I mean, there are two answers for that. There's the things I think they can provide, and I can provide those. But there's also, I don't know what they can provide sometimes. And I think it's really important that we give a bit of agency to them saying, well, actually, I don't know if you guys knew, but I could do this. So there's going to be a whole load of areas. And that is quite exciting about neighbourhood work. There may be things I don't even know that they could provide here. I know that they can provide support for exercise, even if it's just a venue for someone being active. And as you alluded to earlier, that can be in all sorts of forms. Being active means many things to many people. We're very lucky with some of the overriding support we have in Charnwood and in the other areas, providing us better access to and venues potentially for administering vaccines, which we know are important. Reducing social isolation, which we know is incredibly important in this group, as we talked about earlier, the mental health impact that chronic breathlessness and respiratory disease can have on people, and those sort of aspects. And I can certainly, as a medical leader, encourage that and support that, and that is one of my roles, which I genuinely enjoy, David. It really is an important part. But what I'm really keen to hear about from these organisations actually is, what can you do that I had no idea that you could have provided for that person? You have equal say in a lot of this. yes, I'm a clinical leader, and yes, this is a clinical group. We needed somewhere to start, but we're really trying to move that focus a little bit out into the neighbourhood, and that's their domain. That's someone else's domain, where you know what you can do, or you know what you could do, given a bit more coordination or a bit more support or a bit more encouragement. And I want to provide that encouragement and support to say, well, if you think you could have achieved this, let's see what I can do to get you there so that we all benefit. So in answer to that question, I don't know. Who knows what
Brilliant.
they could
Well,
provide there.
I will share ways that people can contact us afterwards. So if there are people listening and they want to be involved, I'll let everybody know in a moment how to get a hold of us and to talk things through. So that's really helpful. And I do think the opportunities for us all to come together and wrap around services will be great. So Leslie, my last question to you is, if we had another conversation in 3 months' time, and I said to you, right, you were telling us about setting up MDTs, new ways of working, what do you hope would be different when we catch back up in, say, 3 months' time?
Well, I'm going to have to start with sort of the medical aspects. I am a doctor at the end of the day, and as from a primary care GP point of view, I want to see patients. I want to see our vaccination rates going up because I know that makes a huge impact. I want to see people, approaching that in better ways. I'd like to see patients being more active and less socially isolated, because those are the things that really impact, and I know the evidence is there. I think I also want to be able to hear and be part of the stories of some of the people, try and actually understand the challenges. And in this morning's meetings, we've already heard of people who are being admitted 15, 20 times a year. Trying to understand how that's happening and what we could learn from that might make me more excited. Should you ask me in 12 months, what do I want to see? I'm also really excited to learn from the other federations, from my other clinical colleagues. General practice can be clinically quite socially isolating ourselves. We work in our offices, yes, we work in teams, but actually clinically, we can get quite socially isolated. And things like this, working not just with my other clinical colleagues, my secondary care colleagues, my primary care colleagues, but also my other colleagues, my social care colleagues, my housing colleagues, and kind of bridging those gaps is the sort of thing I'm expecting to be able to put down in writing and stand up in front of audiences and talk about what we've learned. And that's one of the things I'm finding exciting.
Oh, that's wonderful. Thank you very much, Leslie. That's really, really helpful. And I think as I kind of reflect on me growing older, on my family members who are older and ways of working things through, having and living well for as long as I possibly can becomes really important to me. And that living with an independence, I think, is really important. So anything we can do across neighbourhoods to build and develop people living longer and weller and living with independence, I think is a really good thing to do. So thank you very much, Leslie, for your time today. And thank everybody for listening and being with us. We hope this is one in a series of podcasts coming together with different professionals, community organisations and people from across our national neighbourhood implementation programme in West Leicestershire. If you'd like to be involved, then please do get in contact. If you heard Leslie earlier and saying, what more could communities do, please get in contact. Please do. You can reach us through Leicestershire, Leicester City and Rutland's Integrated Care Board. If you go to their website and contact us, you'll be able to find more information out of it. And we hope that this short podcast has given you a bit of an update on the work, and any feedback you've got is really appreciated. Thank you all very much. Take care.
Thanks, David. Thanks a lot.